if you saw my video from a few months ago, you'll know that I built a voice agent for mental health triage, which was part of the hackathon MedHack for Monash Medical. Now, this app didn't actually go much further. It was an initial proof of concept, and it basically worked, but we ended up running with a different idea. But I've just been playing around with this in the last few weeks, and I thought I'd give you an update as to where the app is currently looking and how it's working. It's actually going really well. So I'm going to run a test now, get straight into it. The idea here is this is a voice AI agent that is going to take a phone call from me. Now, this agent is currently obviously on my computer, but it'll work either through phone or text chat or via an app or via a website. So there's lots of different ways that somebody can interact with this. So we'll just assume this is a telephone call. The agent is going to interact with me and collect my personal details. And there then is some decision making in here about what the agent will do in terms of whether it will pass me off to a human or whether it will advise me to call emergency services if it's an urgent, critical situation. So I'm just going to play along with this and give it some very basic details. And then I'll show you the information that the agent has collected and explain what happens next. Let's get the agent started.
Thank you for calling Regional Health. My name is James. I will need to ask you some questions and take your personal details first so that I can get you the help you need. Is that okay?
Yeah, sure.
Okay, thank you. To start, could you please tell me your full name?
Yep, my full name is David Gilmore.
Thank you, David. And what is your date of birth?
Date of birth is the 21st of February, 1985.
Thank you. And what is your contact phone number, David?
0422 718 718.
Thank you. And finally, what is your address?
My address is 21 The Hill, Morwell, Victoria.
Thank you, David. Now, can you tell me what is happening in your life right now that made you call today?
Yeah, I've been really struggling recently with life in general, fast approaching the age of 50 and don't really feel like I've achieved much in my life. I'm feeling very down. I cry sometimes during the day and I'm just really struggling and I just need some help. I'm not coping at all.
I understand, David. It sounds like you're going through a difficult time. Have you engaged with mental health services before?
I did speak to a counsellor about 6 months ago, nothing to do with the hospital, and that went okay, but I'm still now feeling really down.
Okay, David. Thank you for sharing that. Are you contemplating suicide or have you hurt yourself in any way?
No.
Okay, David. Thank you for letting me know. I'm going to record your personal details and a doctor will call you back within 5 hours. Is that okay?
Yeah, that's okay. Actually, I just wanted to go, before the call ends, also wanted to check with you, what time is the hospital open? If I have to go in, what are the opening times?
The hospital is open 24 hours a day, 365 days a year.
All right, okay. And also I wanted to find out, because my mum's going to have to drop me in and probably will need to park and stay with me for a bit. What's the cost of car parking at the hospital?
Car parking at the hospital is free.
Okay, fine. And if I am admitted to the mental health ward, I think it's called Flynn, what's the opening time, the visiting time? When can my mum and my girlfriend come and visit?
Flynn visiting times are 11 a.m. to 2 p.m. 7 days a week.
Okay, cool. All right. Okay, so you say that a doctor will give me a call back today, yeah?
Yes, that's right. A doctor will call you back within 5 hours. Is there anything else I can help you with before we end the call?
If it's going to take a few hours, I wouldn't mind getting a number, please, to the charity. I think they're called Mind.
The phone number for Mind is 222. Is there anything else I can help you with, David?
No, that's it, thanks.
Okay, David, you're welcome.
Thanks. Sorry, you were saying?
A doctor will call you back within 5 hours. Thank you for calling Regional Health. Take care.
Okay, bye. Okay, so that's the demo. Now, one of the couple of things just to point out is that I've actually added just a fake knowledge base to the agent as well. So it's got some details about my local hospital. They're just fake details at the moment, but it's really good that the agent's got some basic details. So whilst it's been trained not to give out any medical advice at all, so even if you ask it to give you advice or ask it for tips and tricks, it won't do that. But it will give you information to, publicly available information, hospital opening times, car parking as the example I gave you there. So that's just simply a knowledge-based file that can be updated easily, that's given to the agent, and the agent can reference that and use that when answering just general questions. Now that's been done, we'll just go into the back end now, and we'll just see how well the agent caught that information. So we'll just get into the back end section now. Okay, so going into the back end now, you'll actually see that we can, there's a summary of the conversation there. So the AI has actually produced a brief summary. David Gilmore called regional health, expressing feelings of sadness and struggling with life. He had previously seen a counsellor. He clarified he is not suicidal. Now that's a key thing here, because the agent is actually being trained at the moment to recognise and respond to anyone saying they've hurt themselves or intending to hurt themselves or suicidal, and will advise them to hang up on phone 000. The agents confirmed his details were recorded, and a doctor will call back within 5 hours. Obviously, again, that's just fake information in there that can obviously be changed. David inquired about hospital opening times and visiting hours for the mental health ward. He also requested and received the phone number for the charity Mind. Again, I just put a fake phone number in there for the charity. The agent confirmed the doctor's callback and ended the call. But we've also got here then is it separately captured the address that I gave it, 21 The Hill, Morwell. And it's also captured my full name, and it's also captured my phone number and the timestamps in the conversation. Now, what's also very cool here is that this information is then obviously sent to the Triage nursing team, and they can play back the full conversation.
Thank you for calling Regional Health. My name is James. I will need to ask you some questions, David.
2422 718. So that's the complete transcript recording of our interaction that can be reviewed if need be. We can also click on the transcription tab and actually get a full transcript of who said what and when, with dates and times, which is also quite handy. And then there's a client data tab, which can be linked in with other systems, other medical systems, if they've got an API. So this information can be posted to a database or collect information from a database. But this information here is at the moment is set to be automatically emailed. So the receiving team can receive an email, or could be sent as a text message or a database entry. There's various different ways that the responding human team can actually pick up this call. But that's basically how it works. It's looking pretty good. It still needs a little bit of work, but this demo gives you a basic idea of what the agent does, and I think it's got a lot of room to go.